Good morning, everybody. And my name is Ashish John, Professor of Health Services Policy and Practice at the Brown School of Public Health and the Dean of the Public Health School at Brown University. This is the second of our ongoing conversations with public health leaders. The first one happened in August with Dr. Tony Fauci, who's the head of the National Institute for Allergy, Immunology, and Infectious Diseases. Today's conversation is with Professor Heidi Larson. And it's particularly timely, and I'm particularly excited about this event. So let me tell you a little bit about Professor Larson, and then we will get into our conversation. And I have questions that we've already received from the Brown community, and I have some of my own, and we'll get through those, and then we'll also take questions live from audience members. So Heidi Larson is an anthropologist. She's the professor of anthropology, risk and decision science, and director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. She's also clinical professor of health metric sciences and director of the European initiatives at the Institute for Health Metrics and Evaluation, IHME, which is based at the University of Washington in Seattle. Heidi has been working for years on issues around how to think about risk, how issues in rumors and social contagion affect the way people think about health interventions. And where she has really been a global leader, arguably the global leader, is helping the world think more effectively about hesitancy, especially as it comes to vaccines. And that is, of course, the topic of the conversation today, which is about vaccines and about vaccine hesitancy and where it comes from and how we understand it and how we engage with it. So before I welcome Heidi, let me just say one more quick thing, which is she is the author of a new book that came out just as the pandemic was hitting. It's called Stuck by Oxford University Press. And if you've not had a chance yet to get it, I would strongly recommend that you do. This is a topic that I thought I knew a lot about and had thought a lot about. And yet reading this book has really changed my approach in thinking about vaccines and just about trust, confidence, information in health and healthcare much more broadly. So Heidi, thank you so much for being here. Really delighted to have you and excited to get going on our conversation. So, and I think we're still muted.
Yes, thanks. I just happy to be here.
Great. So I do have a whole series of questions, and of course, vaccines are on everybody's mind right now in the United States, but around the world. But you wrote this book well before this pandemic got going, and you've been thinking about these issues for a very long time. So if you don't mind, just kind of starting, what got you interested in the topic of vaccine confidence, vaccine hesitancy, and ultimately what prompted you to write this book?
Well, I've always been interested in the human and social dimensions of why people do or do not comply with their health, what's good for them, so to speak. And I've worked around the world in research or with WHO or with Unicef, many years with Unicef. And one of my, I had a role in UNICEF from 2000 to 2005 as the lead communication strategy advisor on introducing new vaccines and to launch Gavi. The head of UNICEF at the time, Carol Bellamy, was taking on the chair of the new Global Alliance. So I was front and center in this new initiative. And I was supposed to be doing proactive strategies and communication, and ended up in those 5 years getting the nickname the director of UNICEF's fire department. And it was because there was such an epidemic of small and large outbreaks of rumors and they were not, it wasn't that they were of interest per se to UNICEF, but they were really starting to disrupt programs. UNICEF was not used to individuals, communities, and sometimes governments questioning the good things they had to offer, as it were. Being an anthropologist, Carol sent me out to remote places in the world to find out what was the reason and help calm the crises. And more, I saw that people had been hearing about rumors or dissent or anxieties, but thought it would just go away and it would brew and brew and then erupt. And the biggest one was the northern Nigeria boycott of the polio vaccine. The northern candidate for the presidency had lost to the southern, which was the central power. They were not keen to make the central government look good in the polio program. It was also just after 9/11. And there was this deep sentiment in the dominantly Muslim North that the US and the West was at war with Muslims. And why else would they be knocking on everyone's door with a repeated vaccination if it wasn't meant to sterilize them? So there was this convergence of anxieties and rumors, but they shut down. The governor initiated a boycott. And what really struck me was this boycott in one state in Nigeria led to an 11-month boycott, 20 countries around the world getting infected with the Nigerian strain of the polio virus, as far as Indonesia via Mecca, and cost the global program $500 million to regain lost progress just because of a rumor. There was no adverse event. And to me, that was compelling enough that initially I was going to write the book about the polio eradication initiative and the story, as this was a much bigger issue.
Got it. So let me ask you about rumors, because one of the things that's really interesting reading your book is, we hear rumor, we think rumors are bad. Rumors are, they undermine confidence in science. And we talk about rumor mongering as this bad thing. You don't see rumors as such a bad thing or always so consistently as a bad thing. You really lay out a reason for how to think, for why rumors exist and how to think about rumors. And I'm wondering if you can kind of expand on that. How have you come to understand rumors? How should we think about rumors?
I think about rumors, and I use the kind of metaphor of the microbiome. We need to learn to live with rumors, just like we need to live with some viruses. But rumors, by definition, is an unverified piece of information. And that piece of information may turn out to be true, and it may not. But I sometimes start my lectures on risk and rumor by saying rumors have a bad reputation. The instinct is to kind of think they're bad. But in fact, if you go into the belly of the World Health Organization, they have archives of rumor archives from the smallpox days. Even after declaring smallpox effectively eradicated, they put an alert out to make sure that any rumors about smallpox be reported. So, we use rumor detection a lot in trying to listen for signals of early disease outbreaks. They can be invaluable pieces of information, but they can also be highly disruptive. It often, I think the difference is the motive. What's the motive of spreading the rumor? And we've seen in the current environment, the motives are not necessarily in a productive way. And they particularly thrive in times of uncertainty. And that's where I think, the whole COVID environment is so rife with uncertainty that it is the perfect fuel for rumors.
So let me just dig down a little bit more there, because it strikes me, again, in your book and your writings, you talk about rumors as a way to collectively solve problems, right? That you have lack of information. And so you have information filling that gap. And some of it is around filling gaps around uncertainty versus what we have seen with COVID is clearly some of that, but also some amount of, as you suggest, intentional rumor mongering, spreading clear falsehoods. How is there a way to distinguish between the two? Is there a way to understand what is intentional versus, or does that distinction even matter?
Um, the who is propagating it? Yeah, I think the intention is a huge difference, because it gets down to the trust issues too, because I think that, you know, which ones you can kind of think that are more valid than others are going to depend where they come from. And I think it is important to understand, because they can be undermining a health program, or they can be undermining, you know, disease control measures. We've seen it in a number of settings around protests and lockdowns and masking, and it's not just about vaccines.
One last question about rumors, and then I want to move on to talking a bit more about vaccines per se. So you talk about the notion of the ecology that surrounds rumors, and kind of almost thinking of them as a garden that you have to weed out the weeds that grow up in it. And actually, as I was reading that part, I was thinking about your garden, because I've had a chance to visit your lovely home in London, and you have an incredible garden. And as I was thinking about that, I thought again, like in a garden, what's a weed, what's a plant, has a lot to do with intentionality. And so how do you, for those of us who are in the scientific communication business, who are talking about this, how do we approach rumors? How to cultivate rumors, but how do we manage them? How do we try to weed them out? How do we leave some alone because they're serving a useful purpose? What advice would you have for public health people who are trying to think about how to deal with rumors in this way?
Well, I think both public health people, and right now, I think one of the biggest tensions is between public health and government, and the like the social media platforms. I think it's very high risk to get into too much censorship in this environment, that we may be exactly killing one of the signals and pieces of information that might open the door to understanding COVID better. So I think that our deep weeding, as it were, needs to be, you need to be pretty clear that you're not throwing the baby out with the bathwater, as they say. I mean, one thing we know about gardening is, if you keep clipping the head off the weed, it's not going to go away. And it is a phenomenon with rumors. There are certain persistent rumors over time that will never go away. Rumors about sterilization, anxieties of marginalized groups about being sterilized. These are existential anxieties that are never going to go away. They're in the background, and they will emerge when the opportunity comes, when the fertile ground is there, and then they'll sleep in the background, and then they'll come back. It's I think for the public health community, I think what's really important, and one of the points in the book, is before we are quick to dismiss a rumor, we should listen, because we jump to a conclusion sometimes far too quickly in our expert standing, and think that we might know more than a patient or somebody, researcher. And actually, maybe we should listen. Not to say that listening doesn't verify for you that, in fact, it is a rumor, but you might understand a little bit about why somebody is believing it. And that, to me, is the important part.
So that's, I think, a really good segue. And I know we spent a lot of time talking about rumors, because I do think it, at least in my mind, forms such a basis for a central part of the conversation I wanted to have, which is about what are the roots of hesitancy around vaccines specifically. And I know you've studied this far beyond just vaccines, but let's talk about vaccines, because again, they are so prominent in our minds right now. Um, Over the years, like talk to us about what you've learned about what are the roots behind vaccine hesitancy? What gives rise to it? Uh, is it because it's very tempting, again, as a public health person, it's very tempting to say, well, this is an issue of knowledge that, or actually, and this is where I think public health people really go off the rails, often referring to anti-vaxxers as being dumb or being poorly educated. And that has struck me as not quite neither productive nor right. So what is a more productive way, useful way to think about the roots of the vaccine hesitancy movement? And then we can talk about how do we begin to engage with it and address it.
Well, the actual roots, I mean, the very first anti-vaccine league, as it were, was in here in the United Kingdom, in England, in the late 1800s. But it was not an anti-vaccine league, it was an anti-compulsory vaccine league. And it was provoked by around the time of this, when the smallpox vaccine was being uh, given, it was a mandate. And the day it became a mandate, that's when the trouble started in terms of the resent and the dissent. And that's what fueled. It was actually not even the initial mandate, but when they extended the ages that it covered, that really turned people into an uproar. So that is one of the persisting themes in anti-vaccine sentiment since day one. Um, don't tell me what to do. I'm not, it's in part a libertarian thing. It's in part a state. It's about I don't want the state telling me what to do, but it's also an anxiety about the vaccine. But I think that persists. It not only persists around vaccines, we've seen it around, lockdown, around some of the controlling measures that are needed to control the current pandemic, but also are not. It's firing up those, those emotions. Um, Another theme that goes back to the 1800s actually is this is not in God's plan. This is, against religion, against culture. It's just not natural. Injecting, something into a healthy person. How can that be natural? And we are in a time of absolute growing attention to nature, over technology, over modern medicine. It's a growing tension, and it has been embraced by some of those who question vaccines. And so I guess some have referred to this as liberty, purity, and then safety.
And talk about so I get the liberty part, right? We talk about individual versus kind of collective action, purity around what is natural. Talk about safety. Um, what are the concerns kind of among people on the safety side of things, when obviously there's been all the stuff around autism and other things which have been scientifically proven to be not real or debunked, however we want to talk about it. But what are the ongoing safety concerns that animate people who we might simplistically call anti-vaxxers?
Well, I think safety it's one people's willingness to put up with some risks, and all vaccines have risks. Some of it, sometimes it's just a minor, redness and swelling, but there are extremely rare, but there can be serious risks, and that's the reality. And so when you're weighing the benefit and the risk, and frankly, parents are not actually, that's the expert terminology, benefit during risk, because we're always trying to defend it. But actually, parents are comparing risk and risk, which is actually more a legitimate comparison.
Yeah.
Risk of the disease, risk of the vaccine. And when the disease is, imminent and tangible, you're much more willing to put up with that risk. I think the other thing about vaccines is that, they're for healthy people. when you're sick, you'll, take all kinds of risks because medicines, frankly, have a lot more risks than vaccines. Um, you'll gobble them down if it's going to make you feel better, but that's a different story. And we've seen around COVID, for instance, we've been running surveys around willingness to take a COVID vaccine should it be proven safe and effective. And we've seen there was a fantastic article in 2009 around the H1N1 epidemic. It was a Dr. Danielle Offrey who wrote what she called the emotional epidemiology, and how her patients went from this, when are we going to get the vaccine, to not wanting it. And we see the same volatility in people's willingness to take a COVID vaccine, depending on how bad it seems. And it's a legitimate way to be balancing that, but that's where the safety comes in, and in part. And the other thing is, it's not always against a vaccine. What I think we should recognize is that sometimes it's because people believe in other things more. It's not maybe that even that they have an issue with the vaccine, but they have a different value. They have a different, whether it's pro nature, home delivery, gluten-free, vegan, and by the way, vaccine-free childhood. That's a lifestyle, and that's a hard. Or if it's something that's religious, those are hard things. You don't hit that on the head with a piece of scientific evidence. That's a deeper argument.
Yeah, so let's stay on that issue for a second. And I was particularly interested in this issue of natural versus unnatural. Over the last 6 months, I've done probably hundreds of call-in shows on NPR and other places where people call in to ask COVID questions. And a recurring theme that I get from people is, how do I boost my immunity against this virus? Yeah. I feel like I need a better answer. I mean, I tell people to eat well, exercise, and get good sleep. But we don't, like, as a physician, like, I'm not even sure I know how to answer that question. This is not sort of how medical science, I mean, obviously there are things that depress your immune system. But there is this very strong desire to say, well, I want to deal with this naturally. And that sense of naturalness pervades, and as you said, it's beyond just a disease it's everything. It's part of how you live. It's where you live. It's what you drive. It's what you eat. It's an entire identity. And vaccine sentiment gets clearly caught up in it. We saw this in California with very low rates of measles vaccinations, that you couldn't simply put it into a political category so easily. So how do you begin to engage people for whom it's part of a broader identity and it's not a simple, I don't like vaccines or I don't trust them, but because you don't want to, and there's no reason to take on their entire identity. That's not very useful. We like people to have their own identity, but yet at the same time, I want people to get their kids vaccinated, and so talk about how you think about engaging people like that.
It's interesting. I think that you need to put yourself in their shoes, as it were, and try to make it relevant to their frame. It's not going to be, you got to put down the way you usually think and put yourself on the other side. And and there are ways. I know I've had a lot of these opportunities, as it were, if you think of it that way, in the polio eradication efforts, where we would have different religious groups, particularly some minority religious groups, struggling with, can I trust the other? It's not in my religion. The reality is, from a religious point of view, vaccines weren't around when most religious texts were written. So it's all about interpretation. So if you with your interpretation, talk about the value of life and different aspects of it that may have resonate more, that may help. On the natural issue, it's interesting. I had someone come to me who leads a group. There's a network of kind of pro-nature mums in the UK, like many parts of the world, increasingly. And she came to talk to me. She had contacted me. I'd given a BBC interview, and she contacted me afterwards, and she said, "I just wanted to thank you for not blaming parents." And she said, "Would you be open to my coming and talking to you?" And because I'm always say we need to listen, I said, that's fine. And we met, and she brought a dossier of testimonies and things from her colleagues. She said to me, you know, Heidi, there's a lot of women in my network who don't want vaccines, but there are a number of them that actually I think are quite open to a vaccine. But if there's one thing I can tell you, and you need to tell your peers because they'll listen to you and they're not listening to me, they need to talk nicely. Just getting back to what you said, and she had everything from media clippings of political leaders saying all kinds of harsh things about people who question vaccines, to patient provider interactions where every concern they had was dismissed. So in this case, this was a group of parents who you might write it off as they don't like vaccines, when in fact, here's someone who's coming from the inside and saying, if only you would speak nicely, if only your peers would speak nicely. Now that's pretty fundamental.
And it gets at this idea of both being treated with dignity and respect as a way
Absolutely.
to engage with people. Right. And actually, and that leads me to a question, and this is almost as personal for me as it is kind of a general. In your book, you talk about how you, I don't know if you worried or you thought about this issue of, was this book gonna be unpopular in some ways in the public health community? Because I do think, and I'll take ownership of this as well, that there are times when I have been, and I think my peers have been judgmental and have been dismissive of people for where I feel like the science is so clear. Like, of course you should get your kids vaccinated, right? Um, and so trying to get out of that mindset and to listen more and to treat people with respect more, it strikes me as critical. But talk about what you feel like has been the response in the public health community, not just of your book, but of this whole set of work over the years as you have engaged with this and as you've spoken to people like this mom that you mentioned. How has the broader public health community reacted to this?
I think it's changing, but I have to say, but not everywhere. There's still a lot of denialism that this is as a lot of denialism that this is not, this is more than fringe. And but a decade ago, even 20 years, particularly 20 years ago, when I started working on this issue, I had some doors closed in my face saying, be positive, you're just looking at the fringe. It's not fact, it's emotions, just emotions. And I think that the ground has shifted, and unfortunately it's shifting only because it's starting to take such a toll on vaccination programs, and we're getting disease outbreaks. I mean, that's what it takes to wake up some people, and some still deny that it's actually, you know, a lot will still say, oh, it's just an access issue. Well, you know what? We've always had access issues. We've had access issues from day one, and we will continue to. This is not a call to say our real problem is, you know, the hesitancy and refusal, but this is a serious tipping point phenomena. To me, this is not about, you don't need a majority of people to be negative to create the public health and global health impacts that one small sector, but growing, we see it growing, can cause. So I think it's changing. And as Freud said, you can't resolve a problem until you acknowledge you have it. I think if there's one success in the public health community in the last decade, there has been, at least by many, an acknowledgement.
Last question on this, and then I'm going to go to a bunch of questions that we have from the community, some of which came in before, one of which I'm actually very excited to get your reaction to in a second. But let me ask you, so yesterday, I mentioned this just before we got on, yesterday there was a congressional hearing here in the US about the vaccine for COVID-19 and ensuring that people trust the vaccine and the production process. And I thought it was a very good hearing. There were 4 of us on. I was one of the witnesses. And yet it was interesting. Several people brought up, well, just the fact that you're having this hearing will breed lack of confidence in the vaccine. You're making things worse by talking about it. And I have to tell you that I am struggling with how to talk about a COVID-19 vaccine in the context of what has been a politicization by some of our political leaders in a way that does not breed or does not undermine confidence in a vaccine that I hope will be safe and effective. And so how do you see the vaccine confidence issue playing out with a COVID vaccine? And what advice would you have for me about how to talk about this so that I can be constructive and useful and not actually undermine what I believe, which is that once we have a vaccine that's safe and effective, I'm going to want lots and lots of people to get it because it's going to make them healthier and everybody else better off.
Yeah, I've confronted a lot of this. If I talk about it too much, so I guess that's why we're in such a bad state now, as I've been talking about it for 20 years. So you can blame me now, but it's how do you talk about it? Well, I think particularly in the case of the COVID vaccine, we have a huge opportunity now. My view about the whole vaccine hesitancy issue is that we have there's been a broken trust. And it sounds kind of mushy, but it's pretty fundamental in a very tangible way in a number of ways. And what I say in the book, I see that, in the Enlightenment, when the kind of reason overcame religious dogma and science was seen as a great liberator, to many people in the public, science has now become the new dogma. Science is the thing that, well, science said so, therefore. And it's as if it's totally devoid of culture and values and emotions and realities, inequities and power struggles and all the rest. The science said so. So I think that's a challenging thing. So what I think is the antidote to that is not being so the science said so, but again, trying to make it have relevance to people's lives in a way. And I think right now, people are so, the world, and we're all in this together, we're fraying at the edges. In some cases fraying, in some places, we have broken economies, schooling's disrupted, people are losing jobs. It's pretty traumatic. And it's a time when you more than ever, you don't want to talk to a parent and say, you should take a COVID vaccine. You want to say, how are you coping? How is your family's health? Or, what have you missed during this time? Is there a way we can, and in the context of that, bring in the COVID vaccine as part of the conversation. There's so much uncertainty, so many conflicting messages, so much guidance. The scientific community, when you ask about a COVID vaccine, well, if this, if that, if this, and it's the iffiness. So where I think we can get traction is maybe the wrong word, but um, build the relationship is around more certain, familiar, known, basic things that people will feel like you care. And if they feel like you care and there's a trust relationship and you've demonstrated that you care about their whole life, not just giving you a jab so you check that off and maybe somebody earns $1 or 10 um, or 100, I think that will already start shifting the ground. I was just on a panel last week, 2 weeks ago, with the Surgeon General, and we had been on another panel in Brussels, and he said something that I found so poignant and could have relevant to also what I've been writing about. He said, people don't care about what you know until they know that you care. And it really, he couldn't have said it, I couldn't have said it more poignant, but
Yeah.
I think we should remember that.
Yeah, no, that's right. And that makes both total sense and is a powerful reminder that connecting it to things that matter in people's lives that they value is critical to this. I'm going to go to some of the questions from that we got before we started, and we've gotten about a dozen questions just in the last half hour. So I'll try to pull some together, but I have to ask the first one, which I think is really interesting. So it's a student question, Heidi, and says, I've heard that Bill Gates gets $1 for every COVID vaccine. Is that true? And I just thought, like, this is one of those rumors, right, that's out there, that's persistent about how Bill Gates is behind all of this. How do you answer a question like this without, I mean, my first reaction was, this is absurd. And then I had to sort of realize, like, that's in fact the wrong way to think about this. How do you, when confronted with questions like that, and that's why I said this is an unusual question. The rest are the kinds of questions that, would have thought of, but help me think about how you address a question that really is built on these pervasive online rumors. I don't know if this person was joking or serious. It doesn't, in some ways it doesn't matter. Reactions or thoughts to that?
Well, I think it gets back to what we talked about earlier, and what's driving it. And it's clear, I mean, this is a explicit comment on questioning the motive. What's he into? What's he doing? What's he funding all this for? It's going to increase his stocks in vaccines. This is one of the least complicated ones. It's an easy answer, which is no. Whichever student, he is not getting $1 a day for the vaccines. He has given a lot more than he's gotten out of this. In fact, particularly this last year, it's been pretty brutal in terms of the, here's someone who's trying to be hugely generous in the absence of even governments funding some of this. But it doesn't, as you say, the answer is not what matters. It's reflective of the absolute distrust in the motive. And that's what we need to pay attention to.
But answer it quite directly. So if you got asked this question in a Q&A that you were going, you would just say, no, that's not what's happening. And then you just give the answer you just gave.
Yeah. He gives a lot more than he gets.
What's that?
I said he gives a lot more than he gets.
Absolutely. No, and the Gates Foundation and vaccines in general, and particularly even during this current time, has been quite extraordinary. All right, I'm just going through some of the other questions. So let me ask you a question that's come up in a couple of different ways, which is, around how global this stuff is. And so sitting in the United States, sometimes you can think of this as like a uniquely American problem, that like there are a whole bunch of Americans. And then you see data from Western Europe. And one of the things that people often like to say is, well, it's easy enough in America and Western Europe because people here in these countries don't see any of these diseases. This anti-vaccine sentiment really comes from being a victim of its own success, that everything is great here, and therefore you can imagine that this would grow. How global is this stuff? I mean, the story you began with Nigeria reminds me that it's not just an America and Western European problem, right?
Not at all. And as an anthropologist, and really what drove me to write the book is trying to understand. I saw, because of my global role, that this was happening in totally disparate contexts. And the same rumors were playing out very differently depending on the political context, depending on, if you were a marginalized or in a dominant role in society. It was a whole mix of things, also histories. If people had, if they had something that they experienced as a community, in India, for instance, there was forced sterilization at some point in history, that communities have their memories, and that runs deep. In the US, we've got the Tuskegee. There are historic events that may seem historical, but they're deep in the minds and sentiments of people. So that was one thing. But what I do see when I look around at the different, this is not a luxury problem. This is a global issue, a global anxiety that plays itself out in different ways. What I do see is that what's going on in the US and Europe in particular is a deep, slow burn erosion of confidence, deep. And much more widespread. What I see in places like, yeah, go ahead.
No, I was going to say, I didn't mean to interrupt you, but like, I want to hear more about a deep, slow burn of confidence that goes well beyond vaccines, right?
Yes, and it's just to finish the comparison to for instance, Africa, I see there's kind of a more general confidence in the importance of vaccines, but it's really fragile. And what you get these like shocks to the system in Africa. You get wildfires, particularly with the social media environment now. People get scared quickly, and the disruptiveness to programs, I've seen it in Pakistan, I've seen it in different parts of Africa, I've seen it in India, in different places where it's fragile, it's vulnerable, and so it's a much more kind of shock to the system, as it were. But it can really disrupt a program. Whereas in these other countries, it's been a cumulative erosion. But what you say is absolutely right. It's embedded in an erosion in broader trust and a huge polarization of political sentiments.
So let's talk about that for a second, because one of the things that I think all of us, again, I'm going to be a little American-centric, just where none of us have been traveling anywhere. We've all been kind of stuck in our own countries. And America, of course, has had such a horrible response to the outbreak. The pandemic has become, over the last 6 months, just more and more partisan. You could see in polling 5 months ago, differences in political leaders, but the majority of Americans, whether you identify yourself as a Democrat or Republican, largely agreed on what was going on, what the right responses were. And over time, that has drifted apart, and the country certainly has drifted apart. Partly because it feels like we're getting very different sources of information, that people are paying, the sources of information that people are getting and what they're saying feels very different. Do you have any advice from all of your work on messaging or on kind of behavior to say, how do we begin to pull people back together, because the virus at the end of the day doesn't really much care who you are or what your beliefs are. And if we're going to make progress as a country, we really do have to try to bring people back together a bit. So do you have any kind of general advice about how to start rebuilding some of that fraying or even tearing apart that we're seeing in our country? And what can public health people do to help bridge that gap?
It seems so simplistic, but I think the more we can build space for conversations in doctor encounters, in any kind of healthcare setting encounter, people are so pressed for time. They have short interactions. They're not used to all the questions. I mean, they barely have enough time to get people what they need, or hear the key symptoms and prescribe or whatever. There's hardly room for a conversation, never mind being confronted with a barrage of questions. We need to find more spaces, in waiting rooms, in online spaces, in other opportunities in the community where people feel like they can have a conversation. And somehow we have to learn to have these conversations with people who have different views. It's really concerning. And I feel like, in a way, if we can get it right around vaccines, it's going to have an incredible knock-on effect. Because if there's one thing that touches everyone's life and everyone's family at some point in their life, it's vaccines.
Yeah.
And I just think, take that extra, even if it's an extra 5 minutes, just say, how are you doing? And not to start with jumping to the defensive about vaccines. The AstraZeneca trial that got stopped here, and I know the US hasn't jumped back in, but I actually understand not jumping back in because, if you read the headlines and the quotes from people, it was all about, well, this is normal. This is absolutely normal. We stopped this. Don't worry. And I'm like, you know what? Somebody's hurt. Somebody got hurt. Who is saying, of course, we're paying close attention and caring for the person who, and monitoring, and we want to make sure they're well, they're recovering. But you never heard, I know that there's the privacy issues. You couldn't get into the details of the symptoms, but, we care about all of our participants or something, some gesture, but there was so much defensiveness about, and almost a dismissiveness, that I think the tone of it, I thought, this is where we've got a problem. And I think that we need to take those extra minutes to kind of put the caring in, think about the person, and don't, we're so focused on when there's an adverse event, for instance, we're so focused on delinking it from the vaccine that we're not saying, this person, they might have had a coincidental, problem, but why don't we ask them how they're feeling? They are convinced it's caused by the vaccine. And we're, from the public health side, we're trying to make sure that it's not the vaccine. And we somehow have to kind of humanize that conversation.
Yeah,
I'm not saying it's easy, but I do think we need to, and there are people you can have a conversation with more easily than others, and I think that's where we should start anyway.
So I have a couple of questions around storytelling, which I want to get to in a second, but I want to actually stay on this AstraZeneca thing for a second, because it has come up in public conversations I've had on TV and with newspapers maybe 15 times in the last 2 weeks. And I always begin with, well, this is normal as part of clinical trials. And
sorry.
Look, this is why we do this, is so that all of us can learn, right? And part of the problem that I feel, and I'm going to talk about my feelings for a second, but I think a lot of us in public health feel, is that we feel like we're part of a team, and we're a part of the pro-vaccine team. And when you're part of a team, you're not you're not trying to create opportunities for the other side. Again, I'm not suggesting this is the right way to look at it. In fact, our conversation and your book has really made me realize I got to stop looking at this as team sport. But we do look at it as a team sport, and we don't want to talk about any risks because it feels like we're giving fodder to the other side. And I think what I hear you imploring us to do is to stop looking at this as a team sport, to try to understand the humanism behind what exists in people's sense of discomfort or their fears or their desires, and to engage with that, and to not see this as those are the other side and we've got to beat them down. And it's very powerful. It's very, very important. And that does get at, I'm sorry, I'm not sure there was a question there. I don't know if you want to reflect on that, but at least I'm reflecting on my own behavior and thinking, I've probably fallen into that team sport mentality more than once. And I got to stop.
Yeah, I just to come back, I don't think it's a bad thing to say that. I mean, you can say it's a good thing that the fact that they stopped the trial shows the gesture that we care to make it, we want to make vaccines safe. So I think the part of what you said is perfectly, legitimate and appropriate, but it needs more, I think. Sorry, the end of what you were saying, you got me thinking about too many things at the same time.
Sorry, I was talking about not seeing this as a team sport. And
yes.
not seeing...
Yeah. Okay. That was the key word I needed. You can see, I think you nailed it by calling it a team sport, and it's the homogeneity, the central, there's one play, guys, here's the rules and this is what you do. That's where, rather than, I mean, if you look at these maps, there's some fantastically insightful social media maps. There was a great paper in Nature. It was hundreds of thousands of Facebook. It happened to be Facebook, but it could have easily been other platforms. Doing a content analysis of who were the pro, who were the undecided, and who were the explicitly negative sentiments. So you saw, even though the actual numbers of the quote pro people were bigger, they were very centralized, very kind of talking to each other. And then the extreme anti were disparate, less numbers, but if they had 100 of them, they would have 10 groups, 10 little teams, and they would be listening to 10 different types of people's concerns, and they were there with them. Where you get like 100,000 pro, and they'll have one big team and maybe a little bit of variation at the edges. And that strategy was recruiting the undecideds at a rate 500% times faster than the pro.
Yeah.
And just think of the difference between, and forgive me for naming industries, but the difference between the IBM model versus the Silicon startups. I mean, IBM's evolved in the meanwhile, but, it's that I think the public health community is living in a different orbit in that sense, in that model, than where society is. And there's an absolute anxiety to go into that messy, emotional space that is uncomfortable.
Absolutely.
But we got to go there.
Yeah. And so this one of the things that's come up in maybe 3 or 4 different questions is the issue around storytelling. And it begins with the idea that people who are hesitant have stories. I have a friend whose daughter was vaccinated and then and so the question that has come up often is, well, do you need to counter stories with stories? And do we need to have, if you're on the pro-vaccine team, and again, I'm going to really think a lot about this team idea, that I think is not where we want to be. But do we need to be using more stories as a way to engage people, or is that even the right way to think about this?
I mean, I think stories are very compelling, and you know, that's what sells newspapers and what people listen to and what hits, what does they say, go for the heart and the mind. um, but I don't think my story is more important than your story. Is going to change the equation here. I do think stories are important, but I think we also need to see they have a story, and that, you know, you want to listen to their story. The important thing is listening to their story, and you can talk to them about different ways that that story might have been different, or you can talk to them, but I wouldn't, you know, listen, you know, hear the conclusion of their story, but then say, well, yeah, but my friend, you know, he had a saved his life. I don't know. I think we need stories. I'm not saying we need them instead of the facts. Absolutely not. You know, we need a foundational basis for some of the things, but I think the listening part is important, and then figuring out how you can work with that story. I guess it
Yeah, so
takes
listening part
the
really
hardest
just,
ones for
sorry,
me. Yeah. No,
just,
I get a lot of letters and from people who are, I mean, they're heartbreaking stories, some of them. And it's hard sometimes to
yeah.
engage. Yeah.
Yeah, and it's a reminder that again, if you get out of the team sport mentality, you're not trying to say, well, they've got stories, I need stories to beat them because my story is better than theirs. But instead to say there's a common humanity and we need to listen more
Yeah.
than always teach. Last question, it just because we're running out of time, is around, there have been several questions around the issue of what do you do when trusted authorities get things wrong? So CDC says something that turns out later to be not right. Or public health leaders, et cetera, or physician leaders or nursing leaders and others say something that turns out to be wrong. How do you begin to restore trust, faith, confidence in authority, in credibility when that happens? Do you have kind of any advice or thoughts around that?
That's a tough one, because that's one of the reasons, for instance, in France, it's got the lowest confidence in the world in our global monitoring, and others have seen the same. And that was a series of trust breaking things, you know, over different health issues, from HIV tainted blood to other issues that were not even vaccine related. We see issues in other countries that they can have disturbing roots in terms of roots of hesitancy. On the other hand, I think apologies help. I mean, in the sense that, you know, transparency and trying to get engaging with communities to, okay, we, for whatever reasons, this didn't go right, but we need to build trust in different ways. And for instance, in the context of COVID, might have gotten one thing wrong, but think of the other ways where you can build trust. Not being dismissive. Well, you know, these things happen, but we apologize for those who have had you know, been somehow been affected by this. We are making every effort to in future, but also correct this current situation, but then use other ways to build trust. I mean, in the Philippines, and I know we're running out of time, there was you know, risk with a new dengue vaccine. They were very smart with the public health authorities. There was a major breakdown in trust in the health authorities. They didn't try to rebuild trust in the vaccine. They worked on trust in the health authorities, and they invested big time in building trust around a measles vaccine campaign. around a totally different thing. So you got to look at the landscape and see what do people need now, and how can I address their concerns and rebuild trust in other areas while we try to fix this part that went wrong.
Right. So we are at time, and we had promised you that we would not take up more of yours than we have. And so this has been an incredibly eye-opening, helpful conversation. Your book was, for folks still on, Stuck is by Oxford University Press is the name of the book. It is hard for me to recommend it any more highly than I am doing. My takeaways from all of this, perfect. And about rumors and about, and again, what I learned from this, but I've learned from you for a long time, Heidi, clearly I don't even practice all my own learnings, but I try, is to look at this not as a science problem or to look at this as a technical problem, but to look at this as an opportunity to engage with people and to listen and to learn and to understand why these values and sentiments exist, what they are, and how we engage with them, not how do we overturn them. And that feels like a very different way of thinking than what we have, the mental model we've had in public health, which is we'll do the research, we'll find out the right answer, we'll tell you, and you should be compliant. And it turns out human beings are a little bit more complex than that. Any final thoughts before we wrap up?
I think you summed it up perfectly.
Well, Professor Heidi Larson, thank you. This was an enormous pleasure. I feel like I learned a lot. I think our community did as well. And thank you for writing the book. Thank you for the extraordinary work. I think it will make a real difference in helping us guide our country, the world, through what will be still another difficult, 6, 12, 18 months ahead. And really appreciate everything you're doing. And great to see you. Bye-bye.
Thanks, Ashish. I think it's an opportunity. Yeah, thanks. Bye.
Take care. Bye-bye.